responsibility. The milkman, the paper boy, evening TV. Everywhere you look, there's a heart, a hand to hold on to. Everywhere you look, there's a face of somebody who needs you. Everywhere you look, when you're lost out there and you're all alone, life is waiting to carry you home. Everywhere you look, everywhere you look,
Hi, I'm Dr. Elizabeth Zajelski, and welcome. I am the department chair here at Sinai Hospital of Baltimore, and would like to welcome you as you consider our program for residency. We are a very dynamic department that you're going to learn an awful lot about over the next few hours. But I would like to kind of tell you about myself and give you a broad overview of what we're about and what Baltimore can do for you, so to speak. I've been here at Sinai for the last 2 years, which has been absolutely wonderful. I have, believe it or not, 30 years of experience, which has gone by very, very quickly. I am a generalist by training, and most recently had come here from Christiana Care in Delaware. Here as department chair, I have had the pleasure to work with 16 wonderful residents. I do take shifts on call with the residents periodically, and especially enjoy the time that I spend with them on the labor floor and then also in our resident clinic. In addition to our great residents, we also have a staff of employed physicians who are also generalists. And we as a core provide care for our patients, not only on the labor floor, but also in our private practices, which are located at various spaces throughout the Baltimore area. In addition, we have several divisions of specialists. We have our core group of maternal fetal medicine doctors who do support our patients on the labor floor, as we are a level 3 center. So we do have a very wide range of patients with varying medical problems. They are always there and available to help us, from patients with preterm labor to the most severe preeclamptics to patients in HELLP syndrome as well. Our division of gynecology has 2 subspecialty areas. One are our urogynecologists, who are very, very active in teaching our residents and providing the most up-to-date procedures to help women with varying degrees of pelvic organ prolapse. In addition, our division of gynecologic oncology has 2 physicians who take care of women at all stages of women's reproductive health cancers. In order to help support these programs, we do have the Da Vinci Xi robot, and we are actually in the process of acquiring, or actually replacing, our older SI model. In addition, in our program, you will not only be exposed to physicians who are employed by the hospital, but we do have a very robust group of community-based physicians who are in private practice and are more than happy to teach and always welcome residents into their cases. We have a NICU, and we have NICU attendings who are always present and in-house to support any of the needs of our infants, regardless of what time, day or night they are born. There is 24-hour anesthesia presence as well, and we have an excellent group of anesthesiologists to help support us. Now, that's all the things that you're going to do while you're here working with us. Well, what about your downtime? And you do get some as a resident, believe it or not. Baltimore is a vibrant city. I know that now that we're in the midst of the pandemic, that may be a little hard for most to believe, but Baltimore has an awful lot to offer. There is, especially in the Inner Harbor area, we have the National Aquarium, all of some really great outdoor dining in our world-class restaurants. There's an area called Fells Point that also has a lot of really interesting places to eat and things to do and things to see. Because it is so centrally located, you do have the option of being able to go down to Annapolis, spend a day there, do some really great touristy type things, or you can even venture down farther to Washington, D.C., and obviously do all of the things that that great town has to offer. I have a personal preference for D.C. because that's where my granddaughter, who is all of 1 year old, lives with her family. If you'd like to go up to the north, northern Maryland has some absolutely beautiful scenic areas, especially up around the area of the Loch Raven Reservoir, some really great hiking and biking trails. That's the area of the state that I live in. We also have the ability to get up to Philadelphia, get some really great cheesesteaks. There's also the possibility of going down to the Jersey Shore. If you're sports-minded, as I am, and you may find Dr. Arabal is who is our maternal fetal medicine director, is an avid Ravens fan, and you have to wear purple here on Friday. But we can go into that once you're in the program. Again, we offer an awful lot for you, not only from an educational standpoint, but also we have a very collegial environment. Our nurses and physicians and residents all work extremely well together. And there are times when we do get together after hours just to be able to relax and enjoy each other's company. I do hope to be able to meet you as you go through the interview process, and hope that we do have the capability, or that we will be able to welcome you on board as future residents here at Sinai. Thanks.
Hey y'all, welcome to Sinai Community Care. This is our resident continuity clinic where we spend time over our 4 years seeing patients for annuals, GYN, OB, and high-risk clinic. Typically you'll spend half a day per week in clinic. Over here we have an exam room that has a restroom, exam table, and all the slides we need for a visit. Plus an interactive touchscreen that has tons of information about health and pregnancy for our patients. Over here is our procedure room. This is where we're able to do things like colposcopy, AMBs, as well as some complex IUD removals here in the office. Okay, so going back to the rest of clinic, we have ultrasounds and Dopplers for getting fetal heart rates, an area where the MAs perform our point of care testing, so our urine dips and pregnancy test. And then over here, we'll have a few people working hard over here in clinic. Hey there, Dr. Luani. And going back through, here's Lashana, one of our lovely MAs. Down this way, I'll take you over to our microscopes. This is where we can look at slides. We also have some of the glucose monitors over here. Then, down in the back, we've got the office for our social worker, who's here in clinic with us every day, an extra physician workspace, and last but not least, Adama.
Helps us keep everything together. Say hi, Adama.
Hello.
Woo. All right, y'all. So, thanks so much, and welcome to the clinic. Hey guys, it's Aisha again, just here to show you our labor and delivery suite. So we're starting from outside of labor and delivery, this beautiful statue for the entrance to the pediatrics hospital. Alright, so follow me along and Alright, so back here, some of the things we'll see are our triage area, our labor and delivery rooms, our antepartum rooms, other things that are back here. So we also have our MFM suite, so that's where all our patients go for antepartum testing. So for their non-stress tests, their ultrasounds, their BPPs, etc. And then sometimes we'll get sent over. Here will be the entrance to B1, which is our postpartum area. We'll get there a little bit later in our tour, okay? So we'll just mosey on down this way. Alright guys, so we're gonna go down this way. We'll start over in MFM so that y'all can see the antepartum area. So down this hallway is where we have all of our things. So we have all the rooms where the patients get their testing and their ultrasounds. Right now they're closed because it is lunchtime for our lovely sonographers. As an intern, you do spend 2 weeks on sono, and you're able to learn all of the basics of ultrasound. So how you would do a BPP, doing cervical lengths, doing biometry. So it's really helpful, and you'll do that 2 weeks in your first 2 months of intern year. You'll split the month between sono and OB days. Over here are the offices for MFMs. We have 3 full-time MFM attending. They're lovely, and they sit in with us on sign out every morning. I'm going off right now. This way leads us to the ORs for labor and delivery. We have 2 ORs, as well as a 3-bed PACU area for any of our patients that are coming in for scheduled C-sections or to recover post-operatively. Over here is Dr. Z's office. She'll be saying hello to you later. And here is her lovely assistant, Miss Kim. Hi. Hello. Over here is what we call the birthplace conference room. And this room is where we usually do morning sign out. So this is where the night team will sign out to the day team about all the patients on the labor floor. And so both teams are present and attending is present. Because of COVID, we're usually doing it by Zoom as well, so that the midwives, nursing staff, as well as MFM can be on the line as well to hear about the patients that are on the floor and any concerns that we have. So this is our birthplace conference room. So these are our rooms for our antepartum patients, or our long-term players, our mamas that need to be here a little bit longer during their pregnancy. So we have 4 antepartum rooms over here. These rooms are also used for patients that are on postpartum magnesium, so that they can be monitored more closely before they go over to B1. So we'll go through. We've got some of our lovely nurses over here. Wave for the applicants. Hello. Hello. We'll peek over by the nurses. We'll peek over by the nurse's office. One of our very beautiful sunrooms adds some nice light for us over here on labor and delivery. Peek in. People have lunch. Sometimes we'll have get-togethers in here for holidays, for going away parties, retirement parties, etc. Just a nice open space where we can still see all of the tracings, but get to enjoy some sun. All right, so down this way, going down the hall, we have our 8 labor rooms. You'll be able to take a little walk inside those. We have one room that's a negative pressure room, so it's set aside just for COVID patients. All of our PPE.
So this is our front desk area. This is where we as residents, as well as medical students, nurses, and attendings, will all be hanging out during our shifts to write our notes, keep an eye on the tracings, and see what's going on the floor throughout the day. There's also the board app that shows us who's here in terms of patients as well as in terms of residents and attendings. So everyone's up to date. Over here you'll see our lovely AA who organizes our prenatal records and answers the phones for us.
So let's take a look in room 1, which is empty. Lovely. Okay, so let's see what we've got going on in here. We've got a bed, we've got a recliner, couch over for any partners or family that are staying here. All of our rooms have the fetal monitors already set up, so we can get everything hooked up once the patients come in. Over here is where we have our neonatal resuscitation area. The NICU is present for any deliveries that are going to be complicated, babies with meconium, as well as just any other maternal complications as well, sometimes like our MAG patients, and they come for all C-sections, whether they're scheduled or emergent. Okay, so that is a labor room for you guys. Down this way will take you to the resident room, the locker room, as well as our attending room. And then here is the button that all of our new families press just to let everybody know throughout the hospital that they had a baby. Maybe it's delayed. Okay, nice little nursery run. And then over here is our newly constructed NICU. It's in the process. It'll be done by the time you get here. All right, so let's pop over into triage. As you can see, we've got ultrasounds ready and waiting for us to use. Okay, so here's triage room B. Pretty standard setup, just a condensed version of our labor room. So you've got our beds, you've got our fetal monitoring station, all of our supplies in here, speculums, gel, everything we need for the wet mounts nurses. We'll get all that ready for you when you're doing your exam. Our beds do break down. I can show you guys that. So you're able to lift the legs up and then drop the bottom out from the bed, and then slide the whole thing down so that you can do your speculum exams, you can do your cervical, transvaginal exams for your cervical length, etc. Okay, cool. Out here is our triage workstation. So usually whichever nurse is doing triage that day will be out here. They'll see the patients first and will let us know kind of what the patient's story is. We can write notes out here as well. Here's another triage room. We have 3 triage rooms in total. And then back here is where it is like our little lab area. So mostly for us as residents, what we're really coming back here for is the microscopes. You might remember our friend Eliza was over here in her intro video. Cool. All right, guys, let's head over to B1 so we can see our postpartum area. All right. Hello. Hey, Dr. Sonopor, one of our MFMs.
Hello.
This is also where you'll be doing your postpartum rounding in the morning when you're on OB days. The intern is in charge of rounding on all of the private patients that had vaginal deliveries as well as any C-sections that they did. The intern also carries the B1 pager and will be responding to any needs that the patients have or that the nurses have for the patients throughout the day. Here's the nurses station. Way down at the end, you'll see the entrance to the new NICU. And then let us wrap up over here on B1 and we'll head out by subway. So out here, this is one of the other entrances, the Blaustein entrance. You can go up these elevators to go up to the floors that some of our GYN patients are on, but most importantly over here is a screening station as well as subway. Subway is open 24 hours a day, so you're always able to get something to eat even if you're here on nights. Additionally, further down is the pharmacy, which is a really awesome place to be able to send patients to when you're trying to fill their prescriptions, as well as be able to fill your own prescriptions while you're a resident.
Alright, so here we are back in the cafeteria. So you've got a pretty wide variety of things you can get. You've got your go-to pizza, grill station, where they can cook up anything for you. The chicken burgers are very good, as are the fish nuggets. Assorted things here, it tastes really good. We've got a soup station and sandwich station over here. More hot entree. We've got another station over here where you can get really yummy sushi, coffee, soda, drinks. You want to get something, Brian? So here is the Physician's Lounge. So another good place that you can come, hang out, eat with your team, as many of your residents are doing. We've got soda machine here, coffee machines, bagels, pastries, tons of coffee creamer and whatnot. We got the news going. Hey guys, I'm also going to show you our kosher cafeteria here. Sorry. Alright, so come on in here. This is a place where we have a large Orthodox community here at Sinai. This is a place where patients can come and know that they can have food that fits their dietary needs.
Well, y'all, that's a wrap. I hope you enjoyed visiting our MFM suite, labor and delivery, triage, postpartum, and checking out some of the other important spaces in the hospital. Any questions?